warm welcome to Nirmal Bang, ladies and gentlemen. I'm Hiral Dadia. We have Dr. B.S. Ajay Kumar, Chairman and CEO at Healthcare Global Enterprises, joining us on the show. Welcome to the show, Dr. Ajay. My first question coming to you over here is that overall, if you go to see the kind of impact that COVID has had across sectors, across economies, that's been really huge. Now, what is the sense that you're picking up from the healthcare perspective? Because if you look at the kind of data that's coming in from different nations as well, one bit what is positive about India is that the mortality rate is something which is lower, whereas the recovery rate is pretty good. Now, how do you think as a nation we should be dealing with this?
No, I think, as we all know, we have heard stories of how it happened in China, then what happened in Italy, Spain, the mortality rate being 7%, 5%. And we have heard in US where the mortality itself has run into 80, 90,000 and increasing. So all of this has created a very difficult situation for healthcare providers, hospitals, huge stress on hospitals, availability of personnel, frontline workers, hospital workers themselves getting COVID, becoming positive, and the situation on how to deal with patients on ventilators. So we have learned a lot in the last few weeks about the disease and the fact. Initially, we thought it is only a China phenomena, and we all ignored. And it has come to haunt us because it is much more than China phenomena. And when it's look at India, one of the things we have seen is it has increased. Now we are one of the 4 countries in the world highest number reporting. We have now overtaken China in the number of cases, which we thought may not happen with the lockdown measures we took in March. So with that, question is, are we reaching a peak? The second thing is the number of deaths being low, 3% or less. Compared to the China model, we are about same or a little bit worse than China. But also when you look at Thailand and others, we are about the same range, 2 to 3%. But look at the European and American, we are a little definitely less. I think the possible reason and only reason could be that we have a more younger population. And with that, the recovery rate will be higher with younger population. We don't have, like in Northern Italy and in New York, elderly population, which are very high, who are more susceptible for it, particularly when they have other collateral diseases like diabetes, blood pressure and all, and even neurological diseases. So our elderly population being less and youth being more has been an advantage for us. And that is the reason we are seeing less. But also there is this, definitely the understanding of COVID virus is a study in progress. We are learning a lot about it from the first day and now, and even in future we'll learn a lot. As we look at it, there were several strains of COVID, and there are a lot of behavior patterns is different in each section. It could be different in India versus US or Italy.
Correct.
So we have to really study this model in the next few weeks to come before we fully understand why the behavior is different. There are stories where people are asymptomatic, they never have any symptoms, they get cured of it. Whereas people require a lot more intervention. So honestly, this is a study in progress.
Right. Dr. Ajay, one thing I want to understand from you is that, we understood that it started off in China, it spread across now. Now, China did see a flattening. In fact, the cases started going down as well. Suddenly, there is a second wave that has come in China as well yet again. Do you think a phenomenon like this is going to be possible in other nations as well? Because when we read a lot of reports, studies by John Hopkins or study with BCG, everyone is indicating that probably June is the month where we will see peak coming in India. Whereas a second wave is something that could be expected in the month of September, October as well. From the medical perspective, what's the view that you pick up on this?
Yeah. I think, usually the second episode will not be that much when we look at SARS and all that. And particularly, it could be weather related. There was even a recent report which came from several investigators just few days ago, how weather could also have played a role in decreasing the severity in countries like India. So that could be a factor. So in second wave will happen only in the next winter, if at all, in the European countries and US and maybe China. So at that, I think by that time we are hoping there will be vaccination, and also the herd immunity will be in place. There will be, essentially few millions would have been exposed to it, and those would be asymptomatic exposure will be even more. So when you take that into consideration, whether it will have the similar severity, I doubt. By that time, it would be possibly toned down unless a new mutation occurs, which will be more severe. And I don't think this kind of mutation will happen such rapidly. You can look at maybe few years down the road, 8 to 10 years down the road. So in my view, based on the medical knowledge and how the immunity develops and how these viruses react, I don't think there will be a severe second wave. I think also vaccination is in the works. Human trial has started, and with the trial started and the fast track they're doing for vaccination, I think that will be the answer very soon. Maybe even 6 months or 8 months, we will have an answer. So by the second wave is about to come, we may have vaccination in place. So that is our hope. And I think there is a definite possibility of it happening.
Right. So overall, what has been the impact on the healthcare sector, especially if you have to look at private hospitals? Because majority of the sectors have suffered business losses.
Raghavendra, I lost them.
Majority of the sectors I'm saying have suffered business losses.
Sorry, I lost you a little bit. Can you repeat?
Yeah.
Sorry.
I'm saying what I want to understand from you is what's the impact on the healthcare sector, especially the private hospitals, because the first 45 days at least of the lockdown have been really severe. Now things have started to open up. So in the first 45 days, what's the impact that you've seen in terms of business?
It has been rather severe. See, what has happened for private healthcare, non-COVID treatments, patients' footfall has dramatically decreased. By some accounts, the decrease has been up to 70%.
Okay.
And all elective surgeries are not there. Of course, naturally, there are no, people are not coming for hip replacement, joint replacements, hernia operations, all this plastic surgeries, there are nothing. And also the good part of it is a less number of accidents. Even trauma cases are not there, which is positive. But from the hospital you point, maybe you look at it. But
it's always very tricky to talk to doctors and to talk to hospitals from a business perspective, because sentimentally, whatever is negative for business perspective is positive. But otherwise, from a business perspective,
one of the very positive things which we are seeing is the number of people coming with infections like pneumonia, ordinary flu, fever, getting admitted has dramatically come down, which is very positive. And what it is telling us is what an important role the environment plays in our health. I think this is a great take-home message for all of us. This is a great take-home message for all of us. And coming to the business part, yes, it has come down, and we have to re-look at how we are going to go forward. But specialty services like oncology are not changed much. There has been decreased footfall because of the logical issues of transportation, travel, and our international business is near zero now. Patients coming in. So all of that will affect the private enterprise significantly going forward. But unfortunately, if I can take a minute and say, the government has not recognized this. In all the packages they have done, stimulus they have done, they have not considered anything for private healthcare. This is rather shocking. Whole COVID is because of health. The whole economic situation because of health, and how hospitals have been in the front line. They talk about light the lamp for doctors, light this, give a clap, but no stimulus, no packages. Throughout the world, in countries in Europe and in US, they have given stimulus package. Private hospitals have given money to pay their salaries and sustain. But very, very unfortunate that this country has not done that. They want to do it for minors. They want to do all workers, which is good. They want to do it for all other sections except private healthcare. I do not understand what is in their mind. It is rather shocking and a surprise. The cause of all this economic downturn is health. And how do we not spend more money on health to see that this kind of catastrophes don't happen and we are well prepared? They have not addressed it. And I don't know who are the advisors, why they have taken this stand. It is really, for us, it's a dilemma. And we have demanded answers as an association, and none of them have given any answer to this.
Absolutely, I do agree with your point on this one, because overall, if you see in terms of at least the per capita spent in terms of healthcare, India, I think, stands almost at the lowest. If I'm not mistaken, the last number I had read was around between $80 to $100 per capita. Yeah. Whereas if you see China, which is way above us, US is way above us, almost in 5 digits. Now, what according to you should be the spend per capita from the healthcare perspective?
No, just to reiterate what you said, we spend about $83 to $85.
Okay.
China spends in the region of $400 to $500. Entire Europe spends on an average $5,000. US spends $9,400. So per capita minimum we have to spend is at least $300 to $400 to just make it somewhat viable. So people get some good primary care, people get good secondary care, and the burden has been on private healthcare in India. 75 to 80% of healthcare is done by India. And the government is not understanding that they have failed. They have failed. And they have to support private healthcare. Now, what we have been touting is bring a universal healthcare. So everybody has insurance. Everybody can access and say that we will charge you 1,000 rupees, 2,000 rupees per year. Create a pool and use that pool, autonomous body to provide healthcare for all. Like I am a Medicare recipient in US because I was there for 28 years. I can go to any hospital, show that card I have, even though I'm not a US citizen, and get free care with no limits. This is because I paid tax when I was young. So there is 65% are youths in India. Why can't they pay certain cess and create the pool? Because government doesn't see, unfortunately, healthcare as proper value-based healthcare we don't see. We look upon healthcare as cheap. It should be very cheap. Everybody should provide what we get in US at 1/100th the cost. It's not possible. So the quality of care will degenerate to the level where our primary healthcare is poor. By some standards, our primary healthcare is below sub-Saharan region in certain parts. We cannot afford to do this. And the government has to wake up. As you all know, how do we become an advanced country? Education and health. These are the criteria. It is not IT. It is not other industry. It is education and health. But unfortunately, the focus is not there. And we were hoping with this COVID situation, the focus will come on health. But so far, it has not come. I'm very disappointed.
I know. I mean, I think the government will have to work in tandem with the healthcare sector as well to understand how this can be done better. So currently, if you could just help us understand the latest numbers that I was listening to as well, that almost around 600,000 odd surgeries have been delayed across India. This takes into consideration the non-emergency surgeries, cancer surgeries, obstetric surgeries as well. For Healthcare Global, now, what is the kind of impact are we expected to see in terms of FY21? Or do you think coming from the healthcare space, once things abate, once things start to open up, all of these pending surgeries which have happened in the first 2 months of COVID, first 3 months of COVID impact, will be taken care of in the latter part of the year. So as a year itself, we will not see a major impact.
See, Nimal, the issue is cancer is not elective. Cancer cannot wait. And the collateral damage which is happening for cancer care is already significant.
Hmm.
And it can get worse because even states like Maharashtra, Gujarat are still have high incidence. And because of the lockdown being there till even 31st, we have lost 2 or 3 months of valuable time for cancer patients. You know, when you look at doubling time of cancer patients, 3 months is huge. The cancer can literally double sometimes in 3-4 months. So the delay is not only 3 months, it could be even 6 months, because by the time they prepare, they go to the doctor, get diagnosis, come to the specialist, another 1 or 2 months. So the collateral damage may be more in a way than COVID damage. If you look at the mortality rate in cancer per day, it is more than the COVID death per day. Okay. So all of this has to be considered as we go forward. And what we are concerned in Healthcare Global is we may see more advanced cases. You know, we were turning the corner. We had created great awareness and people were coming in early stage. Now again, you know, we have to go back and redo this because people will come in more advanced stage. That is a concern. The impact on our Healthcare Global has been, in the month of April, it was quite severe. We had almost a decrease in footfall by over 50%, okay. 60%. We are, because primarily the calls, we did a lot of video conferencing, you know, we did tumor boards on video. We used the technology to hilt. And we did every day almost like 200 phone calls, almost 40-50 video conferencing, patients going to their home through video. With all that, the footfall was down that much. But the main reason people gave is they had content in their own places where they live. To access the hospital was very difficult. There was no public transportation. Even the friendliness of the police and all were not there because everybody was understanding. Now the things have eased a little bit. People are able to come at least on their own vehicles. Still the public transportation is not there. So until that happens, we're not going to see significant improvement. But footfall is now in the region of 60-65%. So we are beginning to see improvement. But it will take us another 3 to 4 months before we reach 80 to 90% capacity, excluding international. International may take another 6 months before the people start coming in. So this will be a severe downturn for entire private hospitals. Possibly multi-specialty hospitals may go through much more, downside, as you said, because their elective procedures are joint replacement, which people with joint pain may not come immediately. They may take another year to come because they don't want to be in a hospital. They're concerned, who is a COVID hospital? Is there a COVID patient? This fear, the fear is what is going to drive patients away for the next few months until stability and calmness comes in the society. We have to, media and everybody has to become calm and people will come.
Correct. So overall, even if you have to take the specialty hospitals as well, do you think there is a possibility of them reporting negative cash flow in terms of FY21? Because at least with oncology hospitals or something like this, when you're concentrating on something so severe, there is a possibility to return to normalcy. There could be progress that could happen because patients will come back immediately after this. I mean, sooner or later. But do you think multi-speciality hospitals, will be a negative cash flow phenomenon?
Yeah, I think the first quarter will be the toughest quarter for everyone. It will be very difficult to report positive EBITDA for the first quarter. Okay, because the revenue will be so low. Whatever belt tightening you do in terms of fixed costs and everything else, it will be very difficult to report a break-even or positive EBITDA. In my view, the second quarter, I think we will start reporting a little bit better EBITDA profitability with maybe positive EBITDA. And third quarter improvement. Fourth quarter will possibly get to 90% of the normal. So for the year overall, most of the institutions, in my view, will report definitely positive EBITDA, but much, much lower than their previous years.
Right. And overall, with regards to, being prepared for COVID-19, a lot of additional resources is something which is required in terms of manpower, in terms of investments in consumables. Uh, how are you dealing with this? And any of your current hospitals that have been given for COVID treatment?
Sorry, last word, I couldn't hear you.
My last question was, and any of your hospitals that have been given for COVID treatment?
We have our hospital in Ahmedabad, which caters to COVID patients. Right now, we have about 40 patients in the hospital. So we have been taking care of them, and we have created isolation wards, protecting the staff. Unfortunately, we have not had any incident for healthcare workers with COVID positive direct contamination from the patients. So we've been very fortunate, and there has been one nurse or so who had for other reasons, and she has well now got out of it. They returned to normal. And certainly, this has been an issue with healthcare workers, with the doctors, particularly when you have to intubate a patient. Your exposure is more. But one of the things to say India is very resilient, I want to say compliment our country, our culture is, we have been never had any shortage of PPE, masks or anything, unlike in the West. Whereas I know in cities like I have my own relatives and friends in Boston or New York, they ran out of masks. They had to go and see COVID patients without masks, literally in a couple of places. So in India, we have not had that issue. We are very fortunate for the resiliency, and there are more masks than what we require now. We are getting offers to, do you want to buy masks? Even PPE is in plenty supply. So our doctors and healthcare workers are extremely well protected. There is an additional cost, but of course we have to bear the cost in the interest of the safety of the personnel, which all of us have done in the private enterprise as well in the government hospitals. And this is a great compliment to our system and our resiliency. This should be noted by the entire globe, include global entities, including WHO, should know how we have been able to overcome this, because the predictions were not so. Predictions were India will become chaotic, India will have so many problems. But fortunately, knock on wood, so far we have handled it very well.
Right. That's a given as well. So, you mentioned about how much the government should be spending on terms of per capita. But right now, as a sector, what is the need of the hour? How much do you think that the government should be, providing in terms of stimulus to the private hospitals, especially, and in terms of the kind of support that is needed? What do you think that the government should do?
I think the government immediately should create a stimulus package for healthcare, for private healthcare. The stimulus package should be in the region of thousands of crores. Part of that 20 lakh thousand crores, that is what they were supposed to do. And it has to cover all the negative cash flow for us. Either it could come in the form of a grant, which we prefer, or at least they can give it as a interest-free loan to be paid over multi-years. So the stimulus coming into each hospitals, could be small, big hospitals, will help to overcome, like in the US, they have done, small industries loans, big hospital. They have given millions of dollars in US. I know an industry in US which has got $10 million healthcare. And really they were surprised. It came to their account. Once they fill out a form, it is a matter of 24 hours. So the government should set up a form IT where we fill out a form and say, this is our audited cash flow, this is our negative cash flow, and please fulfill that. And the government should send us the money for that. And we can use that money immediately to make sure the salaries and our expenses are paid. The other thing they can do is they owe us a lot of money. Through the ESI, ECHS, various bodies, thousands of crores are owed by us over 3 months, 6 months. At least pay us that much what you owe. Immediately if they release the money, and maybe they can say for future, anticipating the next year you will do so much of ESI work. Why can't they pay us some extra money on that for the future? That way we will overcome the cash flow issue. You know, the government should help us. Even electricity, they have not helped. Can't they waive off electricity? Can't they waive off certain other things, provident fund, for healthcare especially? And I think make the banks give us additional working capital, you know, with zero interest or some interest rate. So there are so many things well, they can do, but they have not taken appropriate steps in this manner specific to the private healthcare.
Right. So that's something that the government needs to look at as well. So from here on, now, if we have to see a revival, especially in terms of, say, growth for the sector, a couple of things that will have to be taken into consideration, especially on the terms of the vaccine, what happens in terms of therapy. In fact, Healthcare Global has been working on the cytokine therapy trial as well. If you could just provide us some update on that as to how does it function and what are the studies indicating on that front?
Yeah. Now, first of all, on plasma therapy, it is very simple. It is somebody who has developed an antibodies. Normally, we develop antibodies if we find any infection. The antibodies will be specific to the COVID virus. So you take those plasma from them, floating antibodies, and you give it to an active patient. So in theory, if it is not a different strain, it should kill the virus automatically like any vaccine. So that is number one. That is what we got approved for a trial, and we are in the process of doing it. We have started treating patients. Volunteers have come forward to give plasma. That is good. The cytokine therapy is a little more complicated. What that means is a thing called interferon, which actually is supposed to fight against the virus. So we take the cytokine from the, stem cells, from the blood component, extract the interferon, and give it, because it doesn't require proper matching, no need for matching, you give it to the individuals to see that this cytokine interferon actually binds to the sites where the virus is, prevents the virus from destroying the cells. Now, there is also a third thing, because we have all heard of the cytokine storm. See, what is happening, a lot of the deaths are not necessarily from the infection itself killing. It's an indirect effect of body creating a cytokine storm. That immunologically, it reacts excessively because of the infection. And that excessive reaction itself is killing patients by creating disorders in the bloodstream and causing problems on the lung and other parts of the body, including heart. And based on the autopsies, this is a great concern we have. What we call as clotting mechanisms, disruption in the blood clotting mechanism. So in order to prevent that, there is a thing called what we call mesenchymal cell therapy. We have also proposed that. With that, it's quite possible the storm won't happen. The body will prevent automatically from the storm happening. This is how even the, some of the drugs, anti-immunotherapy drugs are supposed to work. One by Gilead Group, supposed to work by suppressing the body's response. So this mesenchymal can also suppress the body response. So the three areas where you are actively working to create a protocol. So hopefully we can treat these patients very quickly and prevent any mortality from them.
Right. So that's something. Right. So by
reviewing, we have a big immunology lab for that, and our researchers are working really day and night to come up with these products, and hopefully even antibodies will be very good. And if only that can work, because there is a theory, even people who have been exposed to tuberculosis may not have severe episode of this virus infection. So there are various theories going on, and we are part of that research, and hopefully the data we collect will be very helpful.
Absolutely. I mean, that's something which everyone's waiting out for. And very lastly, Dr. Ajay, I know this is something which media has been talking about, especially with regards to where CVC Capital looking to acquire 36% stake in HCG. Anything that you could share with us on that front?
Now, most of it is already public knowledge that we have asked the shareholders for approval. We believe at this time, when there are so difficult times, getting funding will be very important for us for the future growth. And we are very happy with the investors who have come forward, working with us to see that necessary capital comes into the system, which puts us in a strong position. And one of the key areas for us, as we have already made an announcement, is to reduce the debt. We hope with that and have liquidity because the opportunities are phenomenal for oncology centers to grow and create quality centers. What we need in India today is high quality centers which focus on outcomes of oncology and making sure the teams are there to treat the patients properly the right way first time. So with this funding coming, I think it will put us definitely in a very strong position. HCG is known as a researcher, a technologically advanced people. We use technology, IT, research in a very big way to achieve our goals. And this will really propel us to a different level.
Right. But on the back of the pandemic, do you think the transaction could be affected in terms of on the valuation front?
No, we are more or less, those things have been finalized.
Okay.
And we will make it public also, all those once the shareholders approval comes. So I don't think, obviously, we were told it's very difficult to raise funds during this time. And but on the other hand, investors always see opportunities during this downtime only, for the future. Absolutely. Once you recognize which is an opportune center to do healthcare is supposed to be recession proof. So with all that, some of the investors do see major opportunity, and that is why they like to invest.
Absolutely. And very lastly, Dr. Ajay, any message for the people, for the community in terms of healthcare professionals that you would have in this given point in time? Because, as you earlier also mentioned, that one takeaway is as to how important the environment is for all of us. But anything else that we could take in as a learning from COVID-19?
I think the most important thing here is we should understand the importance of healthcare for any country. And any country can undergo this kind of epidemic or pandemic. And we have to really take a lot of measures as we go forward. We are now talking about spacing. We are now talking about preventive measures. So in the future, how we manage our usual habits, like simple things like spitting, cleaning, washing hands. These are all going to become very important for a society because today the world is one. What happens in China or what happens in Italy will affect India or vice versa. So we cannot live in isolation. It is a global community. We travel, all of us travel every day. So with all this happening, a global scenario should be looked at. And I think all countries should come together, and particularly in India, we have phenomenal healthcare doctors and nurses and all. The human resource is phenomenal. Our natural resource is human resource. And we should use that in terms of education, spending money in healthcare to see that we become global leaders. And what we have shown to the world in this COVID period is we can really do it. And we should really push for research. We should push for empowering people. The government should play a role of a facilitator, as a catalyst to see that these things are achieved. And the human power is enormous. And the talent and IQ of Indians is phenomenal. I think we should achieve that if only they are stimulated by the system.
Absolutely. Very well put, Dr. Ajay. I think great insights that we've picked up from today's conversation as well. And hoping that there is some support, some stimulus that comes in for the private sector in the healthcare space. But stay home, stay safe. That would be a message from Nirmal Bang. We will connect back with you as well once even the funds come into healthcare global and something's done from the government's end to understand what are the kind of developments we could be seeing on the back of COVID. But thank you very much. A pleasure seeing you and having you on the show. Thank you.